Antidepressant discontinuation symptoms have become a significant topic in both clinical practice and psychiatric research. As more patients and clinicians encounter these symptoms, understanding their frequency and impact is crucial. This video explores the latest systematic review and meta-analysis, which quantifies how often these symptoms occur when patients stop taking antidepressants. We'll discuss the background, methods, key findings, and what these results mean for patients and healthcare providers. By the end, you'll have a clearer picture of the risks and considerations involved in discontinuing antidepressant medications. The occurrence of symptoms after stopping antidepressants has been recognized for decades, but only recently has it gained widespread attention in both the medical community and the media. Many patients report adverse effects when discontinuing their medication, which can range from mild discomfort to severe symptoms. Understanding the true incidence of these symptoms helps clinicians guide patients through the process safely and informs future research. This study aims to provide a reliable estimate of how common these symptoms are, filling a critical gap in psychiatric knowledge. Answer these important questions, researchers conducted a systematic review and meta-analysis. They searched major medical databases including Medline, EMBASE, and Central for studies that examined patients discontinuing antidepressants or placebo. The studies included randomized controlled trials, other controlled trials, and observational studies. Only studies involving patients with mental, behavioral, or neurodevelopmental disorders were considered, and those using antidepressants for physical conditions or in newborns were excluded. This rigorous approach ensured that the findings would be both comprehensive and reliable. Researchers screened over 6,000 articles to identify relevant studies. After removing duplicates and applying strict eligibility criteria, 79 studies were included in the final analysis. These studies covered more than 21,000 patients, with a majority being female and an average age of 45 years. Studies varied in design, including both randomized controlled trials and observational research, ensuring a broad perspective on the issue. This large sample size strengthens the reliability of the results and allows for meaningful subgroup analyses. Included studies focused on adults with a range of mental health conditions, such as mood disorders, anxiety disorders, and other psychiatric diagnoses. Most participants were women, and the age range spanned from young adults to seniors. Data on ethnicity were not consistently reported, but the diversity of diagnoses and patient backgrounds adds depth to the findings. By including both those discontinuing antidepressants and those discontinuing placebo, the study could compare specific drug effects with nonspecific or expectation-driven symptoms. Antidepressant discontinuation symptoms refer to a group of physical and psychological effects that can occur after stopping or reducing the dose of an antidepressant. These symptoms are sometimes called withdrawal symptoms or discontinuation syndromes. They can include dizziness, headache, nausea, insomnia, irritability, and more. The study used established scales and definitions, but recognized that different studies might use slightly different criteria. This variability is important to keep in mind when interpreting the results. Meta-analysis found that about 1 in 3 patients, 31%, experienced at least one discontinuation symptom after stopping an antidepressant. This means that for every 3 people who stop their medication, one is likely to notice some kind of symptom. The incidence was lower but still significant among those who discontinued placebo, about 17%. This suggests that some symptoms may be due to expectations or other nonspecific factors, not just the medication itself. Most discontinuation symptoms are mild or moderate. The study also looked at severe cases. Severe symptoms were much less common, occurring in about 3% of patients who stopped antidepressants. For those discontinuing placebo, the rate was even lower, at just 0.6%. This means that while severe reactions are possible, they are relatively rare. Still, clinicians should be aware and prepared to support patients who experience more intense symptoms. Interestingly, a significant number of patients who stopped taking a placebo also reported discontinuation-like symptoms. This highlights the role of expectation and psychological factors in how people experience medication changes. The study estimates that about half of all reported symptoms could be due to these nonspecific effects. This finding is important for both clinicians and patients, as it underscores the complexity of interpreting symptoms after stopping medication. Not all antidepressants carry the same risk for discontinuation symptoms. The study found that certain medications, such as venlafaxine, imipramine, and escitalopram, were associated with higher frequencies of symptoms. Imipramine, paroxetine, and the combination of venlafaxine or venlafaxine were linked to more severe symptoms. On the other hand, drugs like fluoxetine and sertraline had lower rates. This information can help guide medication choices and discontinuation planning. Any clinical guidelines recommend tapering, gradually reducing the dose when discontinuing antidepressants. The study compared outcomes in patients who tapered versus those who stopped abruptly. Interestingly, there was no significant difference in the overall incidence of symptoms between the two groups, though individual studies suggest that slow, careful tapering may reduce the risk of severe symptoms. The evidence is still evolving, but tapering remains a common and generally recommended practice. Way discontinuation symptoms are measured can influence the reported rates. Studies that use structured assessment instruments, such as the Discontinuation Emergent Signs and Symptoms Scale (DESS), found higher rates of symptoms than those using less formal methods. This suggests that more thorough questioning may uncover symptoms that might otherwise go unreported. It also highlights the importance of consistent, validated tools in research and clinical practice. One of the challenges in this research area is the substantial heterogeneity among studies. Differences in study design, patient populations, types of antidepressants, and assessment methods all contribute to variability in results. The meta-analysis used statistical techniques to account for this, but it means that individual experiences may differ from the average. Clinicians should consider these factors when applying the findings to individual patients. Discontinuation symptoms can appear within a few days of stopping medication and are usually transient, but in some cases they can last for weeks or even months. The study found that the length of observation did not significantly affect the reported incidence, but shorter observation periods might miss late-onset symptoms. This highlights the need for ongoing monitoring after stopping antidepressants, especially in the first few weeks. Complicating factor in studying discontinuation symptoms is their overlap with the return of the original mental health condition, such as depression or anxiety. Some symptoms like mood changes or insomnia can be part of both relapse and withdrawal. The study notes that distinguishing between the two can be challenging, and clinicians should consider timing, symptom type, and patient history when evaluating new symptoms after stopping medication. Researchers assessed the risk of bias in each study, finding that higher quality studies tended to report slightly lower rates of discontinuation symptoms. This suggests that methodological rigor matters and that some earlier estimates may have been inflated by less robust research. Still, the overall findings remain consistent. A significant minority of patients experience symptoms after stopping antidepressant. To ensure the reliability of their results, the researchers check for publication bias, which occurs when studies with certain outcomes are more likely to be published. Their analysis suggested that the main findings were robust, though some small study effects were noted, especially in placebo groups. This careful approach adds confidence to the conclusions drawn from the meta-analysis. Clinicians, these findings highlight the importance of discussing potential discontinuation symptoms with patients before stopping antidepressants. Patients should be informed about the possibility of both mild and severe symptoms, and plans should be made for monitoring and support. The choice of antidepressant, the method of discontinuation, and individual patient factors all play a role in minimizing risks. Patients considering stopping their antidepressant should do so in consultation with their healthcare provider. It's important to recognize that while many will experience no or only mild symptoms, a minority may have more significant reactions. Being prepared and having a plan in place can help manage any symptoms that arise and reduce the risk of relapse or severe withdrawal. Studies' findings about placebo groups underscore the power of expectation and the nocebo effect, where negative expectations can cause real symptoms. This means that how discontinuation is discussed and managed can influence patient experiences. Clear, supportive communication may help reduce anxiety and minimize the risk of nonspecific symptoms. As with any research, there are limitations to consider. The included studies varied in design, patient populations, and assessment methods, leading to some heterogeneity in the results. Not all commonly used antidepressants were represented, and data on certain groups, such as those with physical health conditions, were excluded. Despite these limitations, the study provides the most comprehensive estimate to date of discontinuation symptom incidence. Authors note that more research is needed to clarify the best ways to taper antidepressants, identify which patients are at highest risk for discontinuation symptoms, and develop strategies to prevent or manage these effects. Ongoing studies and improved assessment tools will help refine our understanding and improve patient care in the future. Summarize: about 1 in 3 patients discontinuing antidepressants will experience some symptoms, while severe symptoms are rare but possible. About 1 in 6 patients discontinuing placebo also report symptoms, highlighting the role of nonspecific effects. Certain antidepressants carry higher risks, and the method of discontinuation may influence outcomes. These findings can help guide clinical practice and patient decision-making. For both patients and clinicians, the main takeaway is to approach antidepressant discontinuation thoughtfully. Open communication, gradual tapering when appropriate, and careful monitoring can help reduce risks. Understanding that some symptoms may be due to expectations or unrelated factors can also help manage anxiety and improve outcomes. Healthcare providers should offer clear information about the potential for discontinuation symptoms and provide support throughout the process. This includes discussing the risks, benefits, and alternatives, as well as making a plan for follow-up. Patients should feel empowered to report any symptoms and seek help if needed. Most clinical guidelines now recommend informing patients about the risks of abrupt discontinuation and suggest tapering antidepressants when possible. This aligns with the study's findings and supports a cautious, individualized approach to stopping medication. Following evidence-based guidelines can help minimize risks and improve patient outcomes. While this study focused on published research, the experiences of patients are also important. Listening to patient stories and concerns can help clinicians provide better care and tailor discontinuation plans to individual needs. Ongoing dialogue between patients and providers is key to successful and safe medication changes. Every patient is different, and there is no universal approach to discontinuing antidepressants. Factors such as the specific medication, duration of use, underlying diagnosis, and personal preferences all play a role. Clinicians and patients should work together to develop a plan that fits the individual's needs and circumstances. As research continues, our understanding of antidepressant discontinuation symptoms will improve. New studies may offer better strategies for tapering, identify at-risk patients, and clarify the best ways to support those experiencing symptoms. Staying informed and flexible will help both clinicians and patients navigate this complex issue. Conclusion: antidepressant discontinuation symptoms are a real and significant concern for a notable proportion of patients. While most symptoms are mild and manageable, severe cases do occur and require attention. Both pharmacological and psychological factors play a role, and individualized evidence-based care is essential. By staying informed and working together, clinicians and patients can make safe, effective decisions about antidepressant discontinuation.